Welcome to the Healing Grove podcast. I'm Dr. Kristin Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. I'm your host, Kristin Ryman, and I'm so excited today to introduce you to my new friend, Dr. Alice Honican. She's a doctor of naturopathy, doctor of traditional Chinese medicine, a licensed acupuncturist, and a bioenergetic practitioner, and owner, current owner of Longevity Health Center in Roswell, Georgia, which I learned was the first naturopathic clinic in the state of Georgia. Yeah?
Yes. Hi, Kristin. Thanks for having me.
Yeah.
I grew up with a father who's an acupuncturist and a naturopath, and started Longevity Health Center in the 80s. My parents, Kay and Seneca Anderson, actually met at a macrobiotic study house in 1970. And
of course they did.
Yeah. So I grew up, we were a little bit different. We took homeopathics and herbs and supplements, and we didn't eat sugar. We weren't vaccinated, and we were a little bit kind of like crunchy granola hippie kids. And that was, a little different back then. But I remember, going to the office and seeing the patients come in all over, mostly complaining of chronic fatigue syndrome and fibromyalgia. And my dad would try to help them and really try to get to the root cause using different remedies. And I can kind of explain that a little bit for you, how that works.
Yeah, we'll get there. I mean, I just want to acknowledge first off that sort of naturopathic doctors are pretty much the OG in terms of looking for root causes. Like, the functional medicine people have come along in the last 20, 25 years, but naturopathic doctors have been along. Give us a little bit of history. Like where does naturopathic medicine come from, and what are the kind of the tenets of the philosophy?
So back in the 80s, my dad started taking trips to Germany and studying kind of what's called New German medicine and homeopathy. And he started learning from some of the original founders of bioenergetic medicine, how to read the body's energetic system, different acupuncture meridians, and test for toxic burdens on the body. It's called homotoxicology. So we could measure the different acupuncture points. Let's say we measured your kidney point and using kind of an energy system, an energy technology, and let's say your kidney meridian tested very weak. And then we could add a substance to the computer circuit, say mercury. And if that showed that detoxing mercury brought your energy back into balance, we could figure out that was the root cause of the imbalance. So really kind of delving into toxic burdens and then using natural remedies like homeopathy and herbs to eliminate the toxic substance and support the body's elimination systems. So it was very different back then when pharmaceuticals were really taken off and everyone was, doing traditional medicine, which, I didn't study. So I just know about the naturopathic medicine, but, and really being able to help people using homeopathy, and homeopathy is really made from energy.
So interesting. Was there ever a question in your mind about whether you're going to follow in your dad's footsteps?
So I figured out that I was going to follow in his footsteps. And I'm actually one of 8 children, but I am the one that really took over when I was 18. And I wrote an article. I wrote for a project at school, a paper about homeopathy, and really started to learn that. And then I took a course at the University of Georgia called Multicultural Healthcare, and they talked about acupuncture and different forms, seeing a shaman or different forms of medicine. And I decided to go to acupuncture school, and I went out to California. I went to San Diego, so that was really fun to to go out west and have a new experience. But back then, and still to this day in Georgia, you cannot get a license as a naturopath. So it was really important to me and my dad that I get a license to practice medicine and come back. So I studied acupuncture for 4 years and came back and joined the practice. And that's when I started learning the naturopathic part and studying naturopathic medicine. So I've got kind of both the Acupuncture Foundation and the Naturopathic Foundation. And when I joined the practice in 2007, I started learning about spirochetes and Lyme disease and that the root cause of so many conditions. And that was about 2006, 2007 in Georgia, nobody knew about it yet.
So for people listening, spirochetes are the bacteria that cause Lyme disease, or Borrelia burgdorferi is a spirochete. When you say you started learning about spirochetes, was that because you were going to conferences, or was that because patients were coming in and you were somehow picking those up? Like, how did that bug literally get your ideas?
So in acupuncture school, it's not like so much about finding the disease. Someone might come in with knee pain and you try to balance the energy and try to figure out if it's due to a yin or yang deficiency. So I remember, a course about Lyme disease, 30-minute discussion about Lyme disease in school, and that was about it. And then I joined the practice and I'm sitting in with my dad and he's testing different acupuncture meridians and people are coming in from all over the Southeast. And he was, oh, I know what's going on. You have spirochetes. And I never heard of them. So I started attending conferences, integrative conferences, naturopathic conferences, and sitting in with Klinghardt and Dr. Cowden. And actually the machine I used, I purchased, Dr. Cowden showed me, called the Quest, used to be called the Asira. And so I did all the research about spirochetes and we're telling patients about them. But I have to be honest, we were a little fearful of using the Lyme word, because if you Googled it, in Georgia, there's no Lyme in Georgia back then. Really, it didn't exist. That was according to Google and medical doctors. And there's an invisible fence and the Mason-Dixon line, and these Lyme spirochetes can't get in. So we had to be careful with our words and just say, trust us. Your body has the capacity to heal if we get to the root cause. But now things have changed, and I think a lot of it is due to podcasts like yours and people really trying to get the information out there. Now I'm not as afraid to use the word Lyme, but really I'm not allowed to diagnose as a naturopath in Georgia. But a lot of the patients now are more familiar with it.
So back up one second. Do you have a sense of how many states allow naturopaths to practice to the full extent of their license, diagnose, and treat?
I don't know the number, but I'm pretty sure states like Alabama, Tennessee, Georgia do not yet. Aren't allowed to carry that license. So I have the license as an acupuncturist and a doctorate there. So now I am licensed to practice acupuncture, and that allows me to do a lot with that license, but still acupuncturists aren't allowed to diagnose. We find the imbalances. So when I see a patient, I'm like, it's looking like a high viral load, maybe similar to Epstein-Barr virus, but I'm really not as concerned about that anymore as I was when I first joined the practice. I think that people just want to get well, and they're not, after it to turn us in. We're not medical doctors to turn us in and get us in trouble. So I think my dad went through that because he did early on get into some trouble with diagnosing and things like that. So
So in other words, just for people listening, to be clear, it's not that you're diagnosing it and it's faulty. It's that you're legally with that level, with that particular credentialing, you're not allowed to say, this is the diagnosis and this is the treatment for that diagnosis. It doesn't mean you don't know it. It doesn't mean you don't know what to do with it. It just means you can't say it out loud, which is
exactly. And the treatment for imbalances, chronic illness from a naturopathic perspective are going to be different than they might get in modern medicine. So if we do detect Lyme spirochetes, we're looking to open up the lymphatic system and to support the liver and the kidneys, and to eliminate the food intolerances. So really, and then using remedies that can have a positive effect on the body that don't have side effects. That's really important to naturopaths.
Yeah. So, I mean, I know how effective naturopathic medicine is, and I, despite not having a license in naturopathic medicine, tend towards those treatments and modalities as well, because they work and they're non-toxic and they're supportive of the natural innate healing mechanisms of the body. But for people for whom this is new, what would you say are the main treatments that you use? Let's just take Lyme for an example. What are the kinds of things you might use to help people restore balance so that their body will heal from what could be a spirochete infection?
Yeah, so every patient, we test them individually based on their DNA, or in person, you would hold on to these brass electrodes. We connect you to a circuit, kind of like we'd read your car at the mechanic. The light goes on in your car, something's off. We're going to scan your body like we scan your car, and we can read the different energy systems. Our body's 99% energy. So we can tap into that and ask your body questions. Is what's going on? Are the imbalances due to food intolerances, liver congestion, nutritional deficiency, things like Lyme spirochetes or viruses? Then what we can do is actually test different remedies to see what will balance you as an individual. So maybe for you, cat's claw would be effective, and somebody else, it might make them feel terrible. Or maybe for you, cryptolepis. So we can test every single new and tested herb against the body and to see what's going to make them feel better. But then we can also use homeopathy. And homeopathy is an approach to heal the body using frequencies. So what homeopathy is, let's say we took a substance like a bee, and we took a little bit of, say we took a bee and we put it in a bottle of alcohol and water, and you shook that up. And say you took one drop out and put that in another bottle of alcohol and water and shook that up. Say you did that 10 times, and you were left with a remedy of alcohol and water, and the frequency of the bee is in that remedy. And that actually is called apis. Homeopathic called apis. Let's say you had symptoms of itching and stinging and swelling from an insect bite. You take that remedy and that would actually relieve those symptoms. That's homeopathy. So we could actually make a specific homeopathic frequency against the microbes that show up on the scan, for example, Epstein-Barr virus or Borrelia bacteria, and take that remedy every day at a low dose, and it sends a message to your body's electrical governing system for the body to heal itself without any side effect, because all that is energy. The side effect is as you heal, you may get worse before you get better, and that's called a healing crisis or Herxheimer.
Right. So basically, as your body takes on the thing that was there that it was previously ignoring until it got the homeopathic suggestion to do the fighting and killing, you get actually die off from the dying organism. So similar to taking antibiotics or herbs or anything that kills a bug, your immune system, right?
Yep. So it's just a different way. And so everything has a frequency. Every herb has a frequency. So we use homeopathics for every visit, and we also use herbs. And then, of course, we recommend healing therapies like lymphatic drainage and ozone therapy and acupuncture, massage, the chiropractic, things like that.
Right. So let's go back a little bit. I want to hear more about this, these brass electrodes and your body as a car battery, because I think this is probably new information for a lot of my people. Can you tell us a little bit more about what this is, what it's called, how people can access this, and what they can expect?
So we call it bioenergetic testing. I've heard it called meridian stress analysis. I've heard it called biofeedback, autonomic response testing. And the machine I use is called the Quest 4. So if you were in person, my computer would be up, and then in the computer, it's going to run a software, and you're going to hold on to the brass electrodes, connect you to the circuit, and we're going to ask your body questions. And it's really quantum physics. And so frequency is going in your body's measuring that frequency, your acupuncture meridians. Is this frequency causing stress or weakness? And then we can really ask your body a lot of questions, hundreds of questions without any pain, or just really, really quickly. Now I can also do something called muscle testing, but when you get really tired to ask all the questions that we're asking your body during a bioenergetic assessment. So it actually is really scientific. It's just hard to explain quantum physics. That's why I give the car battery analogy. But so then we're going to see, okay, which organs are testing stress or weak? Is it your lymphatic system? Is it the pituitary? Is it the small intestine? Lots and lots of questions. So your listener, they could actually send in a sample, some of their DNA. Usually we use the hair. Put the hair into the circuit and scan the hair, and we can find out, are your imbalances due to things like Lyme spirochetes, mold illnesses, food sensitivities? That may help us guide us into what functional medicine labs to run, which can be amazing but very expensive. For example, Lyme spirochetes, if you want to test one strand of Bartonella, that could be hundreds and hundreds of dollars. So we're able to kind of get to that in a very affordable way. And the body knows what's going on and has the capacity to heal. So it's really amazing technology.
So are you finding spirochetes in people who don't have any clinical signs of Lyme? And in that case, what are you doing about that?
Yeah, so I believe, we have trillions of bacteria in us. Probably every human has a spirochete or two in their body. whether it's Lyme disease, is so many, I think Lyme disease really is about their functioning. If you have chronic pain and brain fog and can't get out of bed and Lyme spirochetes shows up, that's more of like Lyme disease, and that can be a long road. I could get bit by a tick tomorrow, and if my immune system is strong and healthy, I might not need the antibiotics, or I might take herbs. Or so there's so many factors when it comes to our immune system. So I can scan somebody and they might show some different bacteria that could be a diagnosis of Lyme or something like that, but they might be fine. And then somebody else, that bacteria takes them down, and they really need a lot of support.
Yeah. So in your query of the body using this device, this Quest 3, are you asking the body specific questions about whether this is causing the problem, or are you just saying, is this present?
Yeah, I think it's both. It's yes or no. Is this causing a problem? Is this present? What's the priorities I can figure out? I can keep digging further. I can create new tests. Like recently, one of my clients brought me their GI map. So I created an exact test with those exact frequencies, and I called it a GI map. And actually, it matched what they brought in, several of the same bacteria when I ran that test. So I like to do those studies. I've done it on myself for heavy metal testing, sent my hair into a lab and done the bioenergetics. And most of the time we get this very, very similar result. So lab work's awesome. I love doing lab testing, but it can be pricey. So it's kind of nice to have this option that can be affordable for the patient who really needs some support, who doesn't know what's going on and isn't getting answers. They can at least find out what the main issues are. For example, I had someone come in a few weeks ago who had a rheumatoid arthritis diagnosis, young lady, and she had just moved to Georgia not too long ago, over a year ago, from Arizona. And her body looked like it was full of mold, according to my scan. And she came in for a follow-up. She found out there was mold all throughout her house, something she hadn't thought about, a little bit coming from Arizona. Maybe it's a different scenario there. And so that can guide us into what to look for and what the root cause is.
So interesting. Yeah, the Arizona thing, a lot of Arizona people have mold, and they're like, it's too dry here for mold. I'm like, apparently not. Apparently it's not too dry, because
I know. And so I love to then, I can find out the issue was mold. I can't tell you if it's in your house. Here's my mold guy. Here's my clear air guy to help you out. And so That's where like referrals come in, because they start asking me a million questions about where it is in their house. I'm like, I can just tell you, you're sensitive to mold. You need to make sure it's not in your home. Think about your home like your body and make it as clean as it can be.
Yeah. So earlier when you were talking about kind of doing your internal validation studies, running different tests, comparing it to what you're getting on the Quest bioenergetic scan, are you aware of any publications? Are people publishing about this and comparing it in a larger peer-reviewed way?
I'm not aware. And I have to be honest, since I'm a clinician and I'm seeing 30, 40 patients a week, I'm not involved in a lot of that. It's just more of my clinical experience of you will get better, you will feel better. Let's see how you do, where your body has the capacity to heal, really trying to be positive and inspiring for them, because they're kind of upset when they get here. They've been to a lot of doctors, haven't gotten answers, spent a lot of money, and trying to give, to give them some hope. And usually people will get better if they make the lifestyle suggestions and take the remedies. I really believe that the body can do what it needs to do.
Yeah, it's amazing, isn't it? We're really kind of wired to heal if we get the obstacles out of the way and put in the right supports.
And really support, let's talk about water. Let's talk about what you're eating. Let's talk about your sleep, all of those lifestyle things that they're not getting support of. And, not talking about the lymphatic system when you go to doctors and how important that is. And so we want to really give them those suggestions, and we don't have to do everything perfectly all the time, but we have to, every day is a new day to try to live a healthy lifestyle. So sometimes we're going to fall off the wagon and have a margarita or some chips and salsa or something. And then the next day, okay, I'm going to exercise. I'm going to drink water. I'm going to be healthy. I'm going to take herbs, which have so many amazing properties. And so that's what we do. That's how we test. We use the bioenergetic testing in person or remotely. And during COVID, I really believed in it, because we had to close our practice, and they'd be sitting in their car, and we'd go out with our mask on and to stay in business and grab the sample and come in, and I'd talk to them on the phone and scan their sample. And I would find, oh, do you have a bladder infection? Oh, I forgot to tell you, Dr. Alice. And so that just confirmed even more the validity of it. I know it's not a peer-reviewed study, but just cases like that.
Yeah, yeah, amazing. So let's talk about COVID. What did you, I guess I'd love to hear both what you found during COVID that was new, but also what you're seeing since COVID. Like, are you seeing different patterns showing up in people's scans and what people are suffering with?
100%. I mean, I've had patients, well, I'll scan them and I'll say, I'm testing different strands of SARS-CoV viruses, and the computer system I operate with, I can download the new frequencies as they come out, and they'll have forgotten, oh yes, I forgot I had COVID really badly. And maybe that is explaining why I'm losing so much hair. And then I'll start testing antivirals like olive leaf and monolaurin, vitamin C and things like that. So I have found that now it's another toxin for me to test, just like Epstein-Barr virus and Lyme and mold. Now I've got to test these COVID and vaccines. Both of them are coming up for patients. And now I don't know. Like I said, I didn't go to medical school, but I'm having patients come in where they're getting maybe 4 vaccines on one visit. They're getting a SARS-CoV vaccine, COVID vaccine, a flu vaccine, an RSV vaccine, and a shingles vaccine. And they're coming to see me, and they've never heard that this is another category of toxins. And so I have to say, then they say, should I go get my flu shot next month? And I have to say, if it was me, I would not. Your body's full of toxins right now. That's too much.
Yeah. What are some of the things that you're finding helpful in terms of detoxing people from those, especially the newer toxins?
Yeah. So I think that I'll make the homeopathic frequency to detox the vaccine, and then I will support the liver, and then I will use things like nattokinase, which can help break up proteins in the body and can help biofilms, and think anti-inflammatories, curcumin. But yeah, really using that homeopathic frequency, I think, sets clinics like Longevity apart, because it's sending a message: get rid of this toxin, get rid of this toxin, using that frequency. Frequencies, people are starting to talk about it. You probably have heard of red light therapy now is big, and that uses like specific type of frequencies. And we have a light beam ray we've had for 30 years here. Now I've seen people selling frequency watches where little lights are going in. So, oh my gosh, which one is it?
This is the Nikki. I have the Nikki
watch. Yes.
Yeah.
I sent people to his website. I'm like, well, that would be like coming in and sitting under our light machine for an hour a day. Get the Nikki watch. So he explained, I've heard him speak about frequencies really well. And that's kind of what example of homeopathy.
Yeah. Yeah. No, I interviewed him on my podcast after kind of having my mind blown by the allergies frequency on the wellness model. And I was like, this is a real thing. Holy cow. And it's not surprising to me. I guess what's surprising, because I know about frequencies and I know about, distance machines and all the things you're talking about, but it was surprising to me that it's like so simple. Like you just put it on your wrist and hit the button you want. So, but the question I had for him, which I'll ask you as well, how do you choose the frequencies? Is there like a database somewhere that has like all the frequencies known to man and woman and bug that you can
thankfully my system already has those, so I don't have to design the frequency. I know when we have our light beam ray, the work of Dr. Royal Rife, and you sit under the light, and people would come sit under there when they had Lyme disease, and we have a book. We'd look up the specific frequencies for the different bacteria and viruses, and we'd create the programs. And the frequency of 700 might be good for the kidneys, or the frequency of, I'm just giving examples. And so in my computer, those are all in there, and I can actually scan for the frequencies of, say, somebody wants to sit under the light, or I can imprint that into their homeopathic remedy, those specific frequencies.
Okay, that was my next question. So you're actually not just assessing what's there with the machine, you're then also somehow downloading that into the homeopathics.
Downloading that. So I'll take a base. Usually I'll use one called drainage tone, which is liver, lymph, and kidney support. And then I'll imprint all the balancing frequencies. Let's say it's Aspergillus, Epstein-Barr virus, Nux vomica, let's say homeopathic for the stomach. Make that into your remedy, and you would take that remedy for about 6 to 8 weeks. Just a few drops a day, a little bit goes a long way. And those are the balancing frequencies that you need. Then you won't need them again in 3 months. Your body's shifting. They're different answers to the questions you might we're always struggling with something. Maybe in 3 months from now, you're struggling with fatigue, and maybe right now you're aren't sleeping, so it's just different on every visit. So the body kind of like tapping into the body, what's out of balance. I have patients that just come in for a checkup, a couple times a year, or I have, chronic illness patients where we're trying to see them more regularly to mitigate any healing crisis and make sure we're doing the right therapies for improvements.
Awesome. So one of the things I wanted to ask you was, you had mentioned muscle testing and ART and the different forms of applied kinesiology as being sort of, sister modalities, right, to the bioenergetic testing you're using. I'm aware that those practices can be influenced by the practitioner and their belief system and their energy. Is it the same with the Quest machine?
Well, with the Quest machine, I don't have to touch them, and they can just, if they're here in person or remotely, I can put their sample or their body onto the circuit. So it takes away some of my biases. And sometimes I'm like, this person has Lyme, this person has Lyme. Oh, it isn't Lyme, it's something else. Or maybe the body isn't ready to uncover the Lyme. And so that kind of takes away my biases and it makes it more objective. I'm pretty good at muscle testing, but usually I only do that if I'm asking the body 2 or 3 choices, which herbs are best for the adrenals, something like that. I can do some muscle testing, but I think that can be subjective, and this is a little bit more objective, the bioenergetic machine.
Got it. So what are some of the most common, like what are the top 5 things you find showing up? And not necessarily the things on the first or second visit, but like underneath that, like the root of the root of the root causes. Like what are the root of the root of the roots that most people who come into your clinic are dealing with these days?
So of course, the symptom profiles are all over the place: brain fog, chronic fatigue, fibromyalgia, headaches, whatever it is. And I would say, as we're scanning them as far as toxins, a lot of Lyme, spirochetes, and co-infections, chronic viruses, Epstein-Barr viruses, herpes viruses, cytomegaloviruses, all the herpes viruses, and also coronaviruses now. And then I would say mold is a big one. And I don't know if it's because I'm in Georgia or what, in such a hot, humid state. And I've had to learn a lot about that from even my home personally. I have an old home, and it's, got a basement, a non-daylight basement underground, and had carpet, and it got too humid, and we've had to do some mold remediation, and that's a process. But so I learned a lot about that from my patients. So that was kind of good that I went through that. Also, I'll say I did want to mention that, my mom came down with Lyme disease, and a lot of people get into natural medicine because they themselves were sick, but that wasn't the case for me. But early on in my career, my mom's the healthiest person you would know, and she could barely walk very quickly after she was bitten by a spider. And so I really realized how quickly this Lyme could take someone out, even a very healthy person, but also how if you really follow the natural protocol, you will get well. Within 6-8 months, she's 81 and she's a spring chicken. So she was lucky that, she had, the alternative medicine at her disposal, but she did do some medical testing and everything's fine with the orthopedic. So that was really emotional to go through, but also, really helped me have more compassion.
Yeah. Yeah, that's really scary to watch your mom go down. And I'm glad she's better and now back to spring chicken form. That's awesome. Do you see anything else? So I talk in the Healing Grove a lot about sort of that we're more than one limb of the tree, right? We're not just the physical limb. You mentioned a lot of physical limb root causes. Do you ever see other limbs involved? Can you pick that up with your machine? Like, do you look at emotions, belief systems, spiritual issues, social conundrums? Like, do those things show up on your testing?
Sure. We test mental and emotional states, adrenals, cortisol, pituitary. And then in homeopathy, there are remedies called Bach flower remedies, which are emotional remedies. And, I have a few of them memorized. One of my favorites called Oak, those who struggle on despite hardships, or, there's mimulus, fear of known things. And I'll scan someone and find an emotional remedy to help them deal with that for fears and stressors. I also studied traditional Chinese medicine, and acupuncturists believe there's always an emotional component to an imbalance. So, for example, we all get angry sometimes, but unresolved, long-standing anger is really hard on the liver. And we can all be afraid sometimes, but long-standing fear is really hard on the kidneys. And emotional stress that goes on and on and on and on and on. Maybe a loss of a child, something really, really traumatic can all goes back to the heart. So we want to always look for emotional root causes, and early childhood traumatic events, all of those could be why someone might get Lyme disease and somebody else wouldn't. So I think the emotional, I'm just bringing up Lyme because I know that's such a hot topic probably for your listeners, but for any chronic illness, we have to think about the emotions.
Yeah. So tell us a little bit about the other big modality that you guys use that I think really sets you apart, which is the regulation thermography that I read about on your website. Can you give us a little background on that and tell us what you use it for?
Yeah, so we use computer regulation thermography. Sometimes it's called thermometry. Most people know about thermography for breast health, and that's like a imaging thermography, like a camera. Ours is a little bit different. We actually take the measurement of over 100 different points of the body that correspond to the organs underneath them. So say the liver, the point of the liver is right above the liver, the breast points, kidney points. And then you undergo what's called a cold challenge. You're basically standing in your underwear for 10 minutes in a room that's 68 degrees, so that's not fun. Then we remeasure all the points, and your body is supposed to do certain things under stress. Under stress, your body, in that room, your body points are supposed to cool, and actually the points in your head are supposed to warm because your body's supposed to be protecting your brain. And so then those measurements will generate a graph, and that graph will then generate a report about the primary important modalities, the primary priorities of treatment, about the areas that are blocked, that are areas that are inflamed. And it's really looking at the autonomic nervous response system and your innate physiology. So let's just say the breast, for example. I'll get a whole page about the breast specifically. And are the imbalances in the breast due to, say, lymphatic, viral load, endocrine system, toxicity, maybe other organs involved? And so instead of saying, oh, it looks like cancer, let's say, what could be the root cause of the imbalances in the breast, or say the liver. So if you're in that room and your liver heats 3 degrees after the cooling phase, your liver is inflamed and we got to get the toxins out. So then because the software, they've been doing it for 20 years, a report is generated with so much data that it'll give me the priorities, the top 6 priorities of treatment: heavy metals, Lyme, dysbiosis, liver toxicity, cardiac, whatever it may be, which can help me for, say, referring out for other testing, but also where to start, because maybe with that particular patient, starting with Lyme disease isn't the priority. Maybe it's starting with dysbiosis in the gut.
Now, wouldn't you also get that prioritization from the Quest?
Yeah, so the awesome thing about regulation thermography is extremely reproducible. It's actually approved by the FDA for a modality for breast screening. So if you did your thermography and say you didn't do a lot of therapy, you did the thermography every day for a week, it will look identical. Very, very reproducible how your body's responding. Whereas a bioenergetic assessment sometimes is a picture in time, what's going on now. And then that can make it a little, they're both what's going on now, but I would say the computer regulation thermography is a very objective test to let us know what's going on. And I can look at someone's thermography year after year, and I can almost see who that is. That's your innate imprint, your fingerprint, your innate thermal regulation.
Interesting. Are there certain patterns that come up with, say, Lyme disease or COVID on the regulation thermography?
Yeah, so for chronic viral issues, the ethmoid points in the sinuses will look very different from one to the other. And so one ethmoid sinus point could be very hot and one very cold, and that's an indicator of chronic viral load. For Lyme disease, a lot of it has to do with the brain points. If the brain points are cold and blocked and they're not getting circulation to the brain, oftentimes that's Lyme, and they need oxygenation therapies, ozone therapies, or hyperbaric therapies. And also the teeth can tell us a lot about Lyme. And we have the Lyme spirochetes have an affinity for the teeth. And so I can get a whole assessment on, is a dental issue? Is there a periodontal issue? Is Lyme spirochetes in the teeth? And that's affecting the body. So that's fun for me. I like the dental meridian connection. I feel like that's new to maybe some of your listeners.
Yeah. I mean, if you can talk more about it, I remember from the first Klinghardt conference I went to, he handed out this little sheet of like each of the teeth, where like which part of the body that each tooth, referred to or connected to energetically.
So we test each teeth in our thermography. Each individual tooth is measured, how you respond to the cold challenge, and then re-measured. And we can actually see if the dental toxicity is the priority, or is it periodontal or hidden infection, a bone infection, and then we can refer out. But also, is that connected to an organ, and is that affecting the organ? And so here's a case. I can give an example. I had a patient that came in for acupuncture for arthritis in her right hip. She tried chiropractic and physical therapy, and the pain wasn't any better, but she was a healthy lady who was, had a good lifestyle and very compliant. And acupuncture didn't make a big shift. So I suggested she come in for a thermography. A tooth was found to be toxic. I looked in her mouth and she had an old silver amalgam filling. I had her go get that silver amalgam filling out, and I have followed up by email, and her pain is much diminished. I looked at my tooth meridian chart. Underneath it for symptoms, it said right hip arthritis. I went around
for that one tooth, for that exact tooth.
It was so exciting to figure out what was wrong with her. And she was trying everything. And that's what it was. It was toxic substance in her mouth. And that, mercury is one of the most toxic substances on the planet. And it was releasing vapors in her mouth, and that was affecting her.
Yeah. I mean, there's only two places that it's safe to dispose of it. One is like a biohazard container, and the other places apparently are mouths.
Yes. I mean, your listeners, you can go to YouTube and put like smoking tooth, and you can look at a video of someone holding an old, have you looked at this before? You can look at an old filling and put an eraser to it and put it to a black light, and the vapors don't stop releasing. The mercury vapors just keep going and going and going and going. Yeah. And so, that is important to know. I don't mean to scare listeners, but it's important to get these silver fillings out. There's toxic substance in your mouth that dentists hopefully aren't still doing anymore.
Oh, they're doing it. Yeah. I remember I was in my dentist's office maybe 5 years ago, and there was a child who needed a filling, and I was in the waiting room waiting for our visit. And I guess it was the hygienist came out and was talking to the parent, like basically consenting her for this filling. And she said, so you can get the silver filling. They don't call them mercury filling. They call them silver fillings, right? Or amalgams. You can get the silver amalgam, and that's what your insurance will pay for. Or you can get the composite, and it'll be a lot more money. And the woman said, well, is there any difference between them other than the price to me? Like, is there any difference in safety? No, they're both perfectly safe.
So that's very, very frustrating to hear. When you're pregnant, you're not even allowed to eat a can of tuna fish, but yet they'll put silver fillings in your mouth. So I would suggest your listeners to find a biological dentist. Just Google smart dentist. It'll take you to the organization IAOMT, I think it's called. Yeah. Put your zip code in. You'll find dentists in your area who won't put amalgams in, but also really understand maybe more of this tooth organ connection that I was talking about.
And also who know how to take them out properly without causing more damage, because you can cause more damage if you just get them drilled out by someone who doesn't know how to, create negative pressure and use the whole dental dam situation. Like, there's a lot of different pieces that go into removing them safely.
100%.
Yeah. Cool. Is there anything we haven't discussed other than how people can find you, which we'll get to, but is there anything else that you'd like people to know that you feel like would be useful for my listeners?
I just think that your listeners should know that if they're suffering, that there is hope, and that they should really look into naturopathic medicine, which is really gentle and maybe not as invasive as some other modalities. And that if you can really find the right practitioner to work with you, that your body has the capacity to heal. We're in Roswell, Georgia. So, unless you're an hour or so away, you can't come here for the thermography. But if you live long distance, you can send some of your DNA in. You can go to our website, longevityhealthcenter.com, and it'll give you, it's only, it's $225 just for a simple scan to see what your imbalances will be. And that can help guide us. And that, yeah, I really enjoy talking to you on this. I loved your podcast, and I
Thank
appreciate that you're
you.
there and helping the listeners, because I'm just in the clinic, and we need people out getting the information out there.
Well, thank you for taking the time out of your busy day away from your patients to work with us and share some of your pearls of wisdom. It's been so lovely talking to you. And we will leave some links on the show notes below so that people can find you, especially those people who can't travel but want to try the distance experience.
Thank you, Kristin. I enjoyed our conversation.
Me too, Alice. Have a great rest of your day.
Thank you. Bye.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.